Hey everybody! Happy St. Patrick's Day. Thank you for taking time away from your green beer and your Jamesons to get your monthly advocacy fix. I appreciate it. Um, this is something of a weird anniversary for me personally. Last year, St. Patrick's Day was my last day in the AOPA offices before we all started working from home. So I have officially lapped the quarantine, as I'm sure many of you have as well. But there's an end in sight, so reason to celebrate, reason to have all that green beer tonight. Speaking of reasons to celebrate, such as they are, it might not be quite as fun as St. Patrick's Day, but many of you have been reaching out regarding the reporting of your provider relief fund payments, ones that you received automatically from HHS last year. Some of you got one and then applied for and got a second. Some of you might have only gotten that first one. But as I've mentioned on previous webinars, the reporting was originally supposed to be completed by February 15th. But after Congress passed the COVID package back in December, not the most recent COVID package, which we're going to be talking about a lot, but the one that passed back in December, at this point, who can really keep track of which one is which? They moved that February 15th deadline indefinitely. They got rid of that reporting requirement on the 15th, and they have not instituted a new deadline for that yet. The last time we talked, the reporting portal wasn't even open yet. However, it is in fact open now, and you can go in and create your profile. HHS is saying that it takes about 20 minutes to sign up and get your information in there. And once you start, you cannot stop. You have to do it all in one session. However, there is still no deadline for when you have to have your reporting completed. So I would recommend that you carve out 20 minutes or half an hour to get your registration completed, and then go in and set yourself up, familiarize yourself with it so that when the deadline is announced, you're ready to go. But again, there is no deadline on that yet. They have just opened the portal. So you shouldn't feel as though you need to be in a big hurry, but by the same token, since it's open, probably worth going in there and setting up your profile and your registration to get that done. But the big legislative news, as I said, of the past week has, of course, been the passage of a 1.9 trillion with a T stimulus bill. This has, of course, been all over the news, and I'm sure I'll be covering some ground that's familiar to you, but I do think it should be noted what a big deal the passage of this bill actually is. It is simply not every day or even every Congress where you see a bill this massive, $1.9 trillion passed this quickly. If you've been on previous webinars, you know I was skeptical. I will go ahead and say very skeptical that they could get this bill done this fast. Remember, they wanted it done by mid-March to ensure that no one would lose their federal unemployment benefits, which were created last year and were set to expire on Monday. But they extended those, and they got this done. I was very surprised. I think a lot of people in DC were very surprised. And as you know, the Democrats did this with no Republican support at all. It passed the Senate 50-49. And despite some erroneous reports in the news, quite a few erroneous reports, Kamala Harris did not need to cast a tie-breaking vote on the bill. In fact, she did not need to cast a single tie-breaking vote at any point during the debate and amendment process of the bill. She did cast the tie-breaking vote to actually proceed to debate and bring up the bill on the House floor, but she did not at any point need to cast a bill while they were working through the bill on the Senate floor. I did see news reports that said she cast the tie-breaking vote for final passage. That is not true. It passed 50-49 because there was a Republican senator who was absent to attend a funeral, and so he was not present. It passed the House as well on a purely partisan line and was signed by the president last Thursday. Now, that's not to say Republicans aren't trying to take some credit for it. As you know, I do my best to be nonpartisan on these webinars, and this kind of thing has gone on with both parties since time immemorial, really, more so since the invention of social media. But it is funny that a large number of Republicans are tweeting out facets of the bill as victories, even though every single one of them voted against final passage. This is one example from Roger Wicker, a Republican from Mississippi, who is extolling the aid to restaurants that was included in the bill. Again, he voted against the final bill. So in a way, he voted against this funding for these independent restaurant operators. To be fair, he supported the original amendment to that bill, which added the money in the first place, but ultimately voted down the entire bill. So it's interesting. It's an interesting line that folks are walking. But again, both sides do this. This is politics. Welcome to Washington, D.C. Let's take what is probably a far too deep dive into what's actually in this bill, and I apologize, you'll have to look at this slide for a little bit as I go through these. First of all, as I'm sure most folks know, there are these stimulus checks. The bill provides direct payments of up to $1,400 per person. That will reach about 90% of households in the United States. Families will get an additional $1,400 per child. So a married couple with 2 children, for example, could receive up to $5,600. There's the extension of unemployment assistance that I mentioned earlier. The bill calls for providing a $300 federal boost to weekly jobless payments, and it extends 2 key pandemic unemployment benefits programs through mid-September. It'll also make the first $10,200 worth of benefits payments tax-free for households who make less than $150,000. So up until $10,200 of those unemployment benefits, those are going to be tax-free. They won't need to be declared as income. There's a lot of aids to states and territories, municipalities. The legislation provides $350 billion to states, local governments, gives this between all of the 50 states and the District of Columbia, there's $195.3 billion. Counties and cities split about $130 billion in aid. And additional assistance to states has been among the most controversial elements of any COVID rescue package as they've been working on these for the past year. Democrats looked to add $150 billion in the legislation that passed last March, a year ago. Republicans resisted that. It was ultimately not included. The package in December that I mentioned earlier had $160 billion in it, but that also fell by the wayside as it went through the House and Senate. So with Dems controlling Congress, they were able to greatly expand that dollar amount. So again, state and local aid is now coming in at about $350 billion. The package extends the 15% increase in food stamp benefits through September. It was going to expire at the end of June. So nutrition assistance expanded through the end of September. Housing aid, the bill sends roughly $20 billion to state and local governments to help low-income households cover back rent assistance, utility bills, and it authorizes about $10 billion to help struggling homeowners pay their mortgages. So there's a lot of mortgage relief, utility relief, property tax relief in there as well. There is tax credit for families. Lawmakers are expanding the child tax credit to $3,600 for each child under 6. And $3,000 for each child under 18. Currently, under the current structure, families can receive a credit of up to $2,000 per child under 17. So that is greatly expanding the child tax credit. The enhanced portion of the credit will be available for single parents who have incomes up to $75,000 and joint filers who make up to $150,000. On the business side of this, paid sick and family leave, Biden's initial proposal that he originally wanted, he had a provision in there that would reinstate mandatory paid family and sick leave. That was also approved in a previous COVID relief package, but it has since expired. So that's what Biden wanted, but he didn't get it. The bill continues to provide tax credits to employers who voluntarily choose to offer sick and family leave through October 1st. So again, they were not able to make that mandatory, nor have they provided direct cash payments for offering sick and family leave. But there is now a tax credit assigned to that. Education and childcare, most of us probably live in a community, I know I do, where schools are at least partially reopened. Both of my kids are going 2 days a week now. The bill provides $125 billion to public K-12 schools to help students get back in the classroom. These schools would be allowed to use the money to update ventilation systems, use it to reduce their class size, help implement social distancing measures, buy PPE for this teachers and support staff. And there's another $2.75 billion that went to private schools. The legislation does require that 20% of the money be used to address learning loss. In other words, drop off in tests and other things that might have happened over the past year or so by providing extended school days for certain students, or summer school. So a lot of the money that you'll see will be used to expand hours of school for kids that need it, or make classes available this summer. And last but certainly not least, there is a lot more money in there for small businesses. The bill provided $15 billion to the Emergency Injury Disaster Loan Program, the EIDL, which provides long-term low-interest loans through the SBA. I'm sure some of you have looked into that over the course of the pandemic. Severely impacted small businesses with fewer than 10 workers are given priority under this new structure. So again, $15 billion under the Emergency Injury Disaster Loan Program, targeted specifically at smaller businesses. They have re-upped the Paycheck Protection Program. I think most people know what the PPP is, even if you haven't gotten money directly from it. It is taking applications. It is still open for applications for second round loans. They re-upped that program by about $7 billion and have expanded eligibility so more nonprofits are able to take advantage of that. I think a lot of folks know that when the December bill was finalized, it opened the Paycheck Protection Program up to nonprofits, associations, charities, houses of worship, things like that. They have since expanded that even further and put an extra $7 billion in. So good news for a lot of the nonprofits out there that are struggling. So that's all of the non-health related facets of the bill. There really aren't that many facets of the bill that are focused specifically on healthcare. The previous bills passed during the last Congress, they worked to tackle a lot of those issues. You know, they were really meant to help assist healthcare workers and patients throughout the pandemic. So this one was more targeted on economic stimulus than anything else. But there are a few healthcare related provisions worth noting in this new bill. The first having to do with rural health. I should add that the legislation does not include additional money for the Provider Relief Fund. I think I already said that, but it does funnel $8.5 billion specifically to rural hospitals, and that money kind of trickles down in a couple of ways through the communities. Those facilities, rural hospitals, have been among the hardest hit by the pandemic. You know, the big health systems, the for-profit chains, have been able to mostly weather the financial turbulence of this. Some health systems like HCA Healthcare, the Mayo Clinic, I think Kaiser Permanente was another one. They actually at this point have returned some or all of the funding they got through the CARES Act. They didn't need it. But rural hospitals have, as you know, far lower margins, and those that are unaffiliated have fewer resources to fall back on. So Congress thought it was important to provide this additional $8.5 billion funding stream. This relief will provide temporary relief, but it won't prevent hospital closures in the long run. It is very much worth noting, especially for those of you that live and practice in rural areas. The legislation also includes $500 million in grant funding for rural healthcare, which providers can use for telehealth capabilities. So that is important. Obviously, we are working, and I'll talk more about the OMP Patient-Centered Care Act in a little bit, but we're obviously working to get more payment for, well, some payment period for our providers for telehealth. But telehealth was a very large part of this bill, and it was a frequently brought up discussion. So there's $500 million in grant funding specifically for rural healthcare to expand telehealth. So we are looking into ways that we might be able to take advantage of that for our providers as well. Excuse me. Okay. Medicaid incentives. The legislation also creates incentives for holdout states to expand Medicaid to their low-income residents. The federal government's going to temporarily increase the share it pays to states. This is a bit of a long-winded process, a convoluted process, I should say. But they're going to increase the share they pay to states to cover their Medicaid population by 5 percentage points if that state chooses to expand the program. The increased share would remain in place for 2 years, and it applies to the traditional Medicaid population, all of the Medicaid population, I should say, in addition to the expansion population. So it's across the board. That's an important distinction because the traditional Medicaid population is much larger than those in this expansion group. For starters, it'll be a tempting incentive for states who would not normally be keen to sign on to Medicaid expansion. But it's a great incentive for those states that have been financially bruised by the fallout from the pandemic. It's pretty much all of them. And for many states, Medicaid and education comprise a significant portion, usually more than 50% of the overall state budget. So this expansion is going to be very, very tempting to a lot of governors who have said they did not want Medicaid expansion going forward. So there's additional COBRA benefits for those who have lost their jobs, in addition to unemployment insurance that I talked about earlier and the cash payments. One section of the bill would provide unemployed workers with continued health insurance benefits for free under the normally, as you know, expensive COBRA health benefits program. Workers who lose their employer coverage and any dependents can now keep their group health coverage for free through September 30th. That is through a provision of the bill that gives businesses tax credits that they can use to keep any departing workers covered. without the workers themselves having to actually pay anything out of pocket. So now the federal government will pay 100% of COBRA premiums for those employees who lost their jobs during the pandemic, whether or not it was directly applicable to the pandemic. That's actually more generous than the original version of the package that was passed by the House. The House passed their bill first and then kicked it over to the Senate. The Senate made some changes, and one of those was to increase those payments to 100%. The House bill included a federal subsidy that covered 85% of the premiums. The Senate upped that to 100%, and that was in the final bill. But let's talk about, real quick before I take questions, of which I'm sure there are some, ACA expansion, which in terms of healthcare was probably the largest and probably most controversial part of this legislation in terms of healthcare. Now, the ACA made premium tax credits available to people purchasing health coverage on the marketplaces, but generally only when their incomes fell between 100% and 400% of the poverty level. These subsidies work by capping what an enrollee must spend on what they call a silver benchmark plan at no more than a certain percentage of the enrollee's household income. The premium tax credit amount equals essentially the difference between the actual benchmark plan premium for that individual and the required contribution. The tax credit can be applied to any metal level plan, but there's a sharp cliff that exists and has existed since the start of the ACA at 400% of the poverty level. So, for example, previously under the ACA, a 60-year-old making $50,000 per year, which is about 392% of the poverty line, would pay no more than $410 per month for a benchmark silver plan. However, if that person's income crossed $51,000 per year, which is 400% of the poverty line, health insurance would then become much, much more expensive through the marketplace, through those metal plans. For example, at an income of $52,000 a year, which is 408% of the poverty level, a 60-year-old would have to pay the full price premium, which for a benchmark silver plan is like $957 per month. That's nationwide. So the doubling of this premium payment for people with incomes just above that 400% of poverty mark has been called a subsidy cliff, because it rises so exponentially once you hit that $52,000 income range. I mean, there have been many stories of people who have declined raises at their job, who have turned down bonuses and things like that to make sure they're staying below that subsidy cliff and that they can keep that their original premium prices, which are considerably lower. And of course, there are millions of uninsured people who could be getting subsidized coverage, insurance coverage on the ACA marketplaces, but they have not taken advantage of this, usually because the financial help available to them is simply not sufficient to make that premium or the deductible affordable. And you can see on your screen a very good summation of everything I just said. So these additional subsidies will yield substantially lower premium payments for the vast majority of the nearly 15 million uninsured people who are eligible to buy insurance on the marketplace. And there's nearly 14 million people who are insured on the individual market. So with some exceptions, most of these 29 million people could see lower health insurance premiums as a result of these subsidies. And many should be able to afford lower deductible plans. All that said, I mean, it's a good expansion. It's controversial, as I said, because of the money attached to it. But it is far from certain how many people will actually take advantage of this. You can be sure the administration, specifically HHS, will be keeping a very, very close eye on how many people are now going to the marketplaces for this expanded coverage and going in for that. So a huge plan, a huge change, I should say, for one of the key facets of the ACA. And it's just fascinating that over the course of the Trump administration, we heard so much about how Congress or the Republicans and President Trump wanted to dismantle the ACA. And here, kind of the first thing out of the gate that Biden does is kind of re-up the ACA and expand the marketplace. Not really necessarily, I guess it's expanding it, but making it more financially accessible for more people. One more thing real quick before I pause for questions. One thing that was not in this bill is a delay on Medicare sequestration. Remember, there was a delay on the bill that passed late last year that delayed any sequestration through March 31st, just 2 weeks from today. The House of Representatives will take up, and in fact, I believe as we speak, is taking up an extension of the Medicare sequester moratorium. I'm sorry, they're not doing that today. That's actually going to be early next week. But the House Rules Committee met yesterday to pave the way for this legislation, HR 1868, if you're playing along at home. And that legislation would prevent any across-the-board direct spending cuts through sequestration. AOPA has weighed in with our support. The chair of the House Rules Committee is Congressman Jim McGovern of Massachusetts, who is actually the representative of my hometown, and so I've known him for a while. Who normally, by the way, throws a big St. Patrick's Day event, which this year is going to be virtual, but that's neither here nor there. So instead of having green beer, I told him that we supported delay of the sequester cuts. Same thing. But we, along with many other healthcare groups, we wanted this extension included in the final version of the last COVID package, but we were unsuccessful. But it all ends up kind of being the same thing. It's gonna pass Congress. They do not want, it's a bipartisan issue. They do not want sequester cuts of it could be up to 6%. There's actually two different cuts that are looming. One is 4%, one is 2%. Congress doesn't want either of those to go through. So it's a safe bet that by late next week they'll have passed the legislation to make sure that doesn't happen. So that's a very large and wordy rundown of a very large and wordy bill. So let me just pause there real quick and see if anybody has any questions, if anybody is still awake, and we'll pause there before we go through the rest of what we've got on our docket today.
Not seeing any questions right now, Justin.
Got it. I either explained that really well or put everybody to sleep. So, as is standard for me. So let's talk about a couple of other pieces of legislation on which we are working with Congress right now, one of which you are very familiar with and one of which is relatively new to us. Let's talk about the new one first. The first bill is, it's a thing that, it's legislation that you think should already probably be a thing. It's not a thing, and it should be. So this is a bill that would allow veterans who have lost a limb, they're in a wheelchair, they are blind, or they have other health issues, that make it tough for them to go through health screening at an airport to be eligible for security screening through the TSA PreCheck program at no cost. This is something of a no-brainer, but there will be obviously costs associated with a bill like this to the government. So there are, the quote-unquote fiscal conservatives who are coming out against this. They say it's well-intentioned, but it's going to cost money. So we're working to drum up support on this bill from a wide swath of Congress. This is a relatively new piece of legislation. But this is something that obviously we think is important, and again, should be a no-brainer. So this is something we're dipping our toes into. I don't know if you will see this. In fact, I'm pretty sure you won't see this as one of the main asks for policy forum in a month. But that, we have any number of issues that we work on throughout the course of a year that just don't rise to the level of needing all our advocates to talk about it. So this is probably something you'll be getting an email about, so we can do some support letter writing around this. But anyway, I thought it was important to point it out because it is a piece of legislation that we think is important. So, but of course the big one, whoops, as he skips forward one extra slide, there's the Medicare O&P Patient-Centered Care Act, which should be introduced today. Yes, literally today. I know you're thinking, Justin, you buried the lead. Why didn't you say this bill was going to be introduced today earlier? We expected this bill to drop, frankly, in the last week of February, actually. We've been expecting this bill for a while. So it's taking a little longer than we thought it would, but there's good reason for that. One of the main Republican sponsors last year is Representative Brett Guthrie from Kentucky. He is now the ranking member of the Energy and Commerce Health Subcommittee, which is the subcommittee that will have jurisdiction over this bill once it actually does drop. He was an original sponsor last year. It is sometimes not palatable for a legislator, for a representative, to introduce a bill or be a main sponsor of a bill that is referred to their own committee. They don't want to be seen as self-dealing. However, Representative Guthrie thought, and we agreed, and we said as much, that this is a bill he's been on for several Congresses now. So there's can't be any illusion of self-dealing if this is not something new. He's always supported this bill. So he will be on there as an original sponsor, and it is fantastic to have the ranking member of the Committee of Jurisdiction as an original sponsor, because of course they're the first step in getting the bill passed. So we should have a much easier time in this Congress getting this bill a hearing and a markup and moving it up the food chain than we had in the last Congress. So we expect this bill to move fairly quickly once it is introduced through the subcommittee, and then it'll go to the full committee. Chair of the full committee is Frank Pallone. We're actually on a Zoom with Frank Pallone later this afternoon. He's another guy that I always hold had a St. Patrick's Day party, which is also going to be virtual this year. So we'll be talking to Representative Pallone about that later today. But we expect a much easier path for this bill in the House than it's been in the past. Again, I think I said this on last month's webinar, but once this bill is introduced, you'll be hearing a lot about it via email. This will be our main policy ask at the policy forum, so there'll be a lot of information coming there. But keep your eyes peeled. So it seems that at long last, we will finally get this bill today. Worth the wait, very much so, because of getting Representative Guthrie on there. So we're very excited about this. Speaking of the policy forum, I want to remind everybody that it is 2 weeks this year. Over the course of 6 days. There you see the dates on your screen. I would remind you that you do not need to be present for all 6 days, far from it. We're going to have an introductory session on April 20th from 10 a.m. to 1 p.m. Eastern, kind of going over our issues and kind of going through the things we're going to need to talk about, what to expect. And then I will set up your Senate appointments for you, either later in the day on the 20th or on the 21st and the 22nd. Let's actually skip to the next slide, which flushes this out a little more. So like I said, you do not need to be available all those 6 days. And we are setting up your Senate appointments for you. But we do want you to set up your meetings with your own representatives, which will be the next week, the 27th, 28th, and 29th. Sorry, 26th, sorry, 27th, 28th, and 29th. Yes, sorry. So we want to make sure that you register early if you have not registered, so that we can get your name and we can start making those appointments. We can start connecting you with other people who are from your congressional district to make sure that you are all on the same page. Obviously, we don't want more than one person from the same congressional district reaching out to make that appointment. So we're doing everything we can to coordinate folks and make sure that you're all doing this together as a team. And we will do a lot of hand-holding. So if you need the name of your health staffer for your representative, if you need the name of your scheduler, if you need any information at all, we're here to help with that. Several of you, I am sure, have already gotten emails from me. If you've registered, you've probably already gotten an email from me, just kind of thanking you for attending, letting you know what the process is going to be and next steps. So if you have not gotten that email from me, you will soon. And if you have not registered, please do so as soon as possible. The sooner you register, the sooner we can start making your appointments. So we're really looking forward to this. It is a very different way of doing this meeting, but I think it's going to be very effective to have 2 full weeks of hitting the hill. Since we don't need to be in DC. I wish we were all in DC. I'd love to be able to see any of your faces, of course. But this is the best we can do, at least this year. So again, please do sign up if you have not registered. If you've not registered, I think it's going to be a great event. Our next one of these will not be until May, because we're not going to do one next month. So no advocacy webinar next month, simply because we have the policy forum. So everything you'll need to know about what's going on in advocacy will be done through the policy forum. So please do register for that. But our next webinar, our next one of these will be May 19th, which will undoubtedly be a big recap of our successful policy forum. So thank you again for being part of this webinar. Again, here's my email address. If you ever have any questions, comments, concerns, please do let me know. Watch your email for news of the Patient-Centered Care Act. Watch your email for updates about the policy forum. And I will pause one more second, as we are 2 minutes ahead of schedule, to take any questions.
Yes, so you actually do have a question. And thank you, Cheryl, for raising this in regards into when they should start recommending, when you recommend reaching out to representatives, I guess, in regards to the policy forum.
That is a great question. So Congress usually, it depends on the office. You ask, 435 offices, you're going to get 435 different answers. My experience has been about 4 weeks early, and we're coming up on that for senators. That's why I'm urging everyone to register as soon as possible, because of course senator schedules fill up a lot earlier and a lot busier than representatives. So I recommend 4 weeks for the senators, but of course we're doing that on our end. But I would say about 2 to 3 weeks for the representatives. The reason for that is, under normal circumstances, they don't have their committee assignments. And they know their committee assignments, they don't know their committee schedules. So you want to get on their schedule as early as possible, especially since we're in a virtual environment, because they can multitask. They can sign off of a committee meeting, a virtual committee meeting where they're on screen, and just kind of look over at a different screen or bring up a different Zoom to talk to us. But the earlier we get on that schedule, the better off we are. So now is certainly a little bit earlier, a little bit too early for the House side. They'll just say, can you write us back later? Or what I found, and this is not a knock against any members of Congress, what I found is they'll just say, well, this is too early, and they kind of ignore your email, assuming you're going to follow up at some point. So I would say about 2 to 3 weeks. I'll say 3 weeks just to be on the safe side. About 3 weeks out is when you should start looking at getting those appointments. And again, if you need any contact information, well, whether you need it or not, you're going to get it, of the scheduler and the health staffer. We'll be sending that along to each of our attendees. So thank you. That's a great question.
Justin, that's it for questions.
Excellent. Well, thank you, everybody. I look forward to virtually seeing all of you at the Policy Forum. And again, keep your eyes peeled for emails from us over the next couple of weeks. Thanks, everybody.